Maria Gonzalez had been invisible for 12 years, pushing her mop cart through the halls of St. Mary's Hospital while doctors made life-and-death decisions around her. They never knew that before she cleaned their operating rooms, she had commanded them. As Major Gonzalez, the youngest trauma surgeon to earn the Army Commendation Medal for saving lives under fire. When a construction accident brought in 6 critically injured workers and the ER was short-staffed, Maria watched from the hallway as young residents struggled with procedures she could perform in her sleep. One patient was dying, and Maria had 30 seconds to decide, stay invisible or reveal that the hospital's janitor had hands trained to heal. Welcome to Hidden Legends. Before we begin this powerful story of courage, skill, and forgotten heroism, tell me in the comments where you're watching from today. And if you believe stories like this need to be heard, hit that subscribe button and help us make sure they are. St. Mary's Hospital never stopped, patients flowing day and night, doctors rushing around, ambulance sirens screaming constantly. And in the middle of this chaos, there was a woman moving quietly through the corridors, pushing her mop cart with steady hands. Maria Gonzalez, 44 years old, hospital janitor for 12 years, short graying hair, always in blue scrubs, never drawing attention to herself. Her shift started at 10 p.m. and ended at 6 a.m., the hardest hours when emergencies were most critical and staff was minimal. But Maria never complained. She quietly cleaned around doctors as they worked, emptied trash bins without interrupting conversations, mopped floors while staying invisible. Everyone knew her as Reliable Maria, the janitor who never called in sick, never caused problems. Other hospital staff found her unremarkable. She never joined conversations during breaks, never shared details about her personal life. She just did her job, then quietly went home when her shift ended. Dr. Jennifer Walsh, the night ER chief, appreciated Maria but didn't really notice her. To Dr. Walsh, Maria was dependable cleaning staff, exactly what a busy hospital needed. She never questioned Maria's steady movements around trauma patients, the way she instinctively stayed out of the way during procedures, or why she never flinched at the sight of blood. Young Dr. Kevin Park was different. He'd been working at St. Mary's for 8 months, trying to gain experience in emergency medicine. Kevin had started observing Maria during quiet moments. Sometimes he noticed strange details. Maria's hands never trembled, even when cleaning around the most gruesome cases. She moved with precision around medical equipment, never bumping into IV stands or monitors. And, strangest of all, when she cleaned the operating rooms, she seemed to know exactly which instruments belonged where. Kevin was curious, but hospital hierarchy meant janitors and doctors didn't make small talk. That Tuesday night changed everything. It was 11:47 p.m. Maria was finishing the third-floor corridors when the ambulance sirens started. Not just one, but several, one after another, growing louder. The first radio call crackled through the hospital's emergency system. St. Mary's, we have a construction site collapse, multiple trauma victims inbound. ETA 4 minutes. Dr. Walsh immediately activated emergency protocols. All available personnel were called, but the night shift was always short-staffed. 2 attending physicians, 3 residents, 4 nurses, and a handful of technicians. Maria continued mopping, but her trained ear caught the details being radioed in. 6 workers trapped under collapsed scaffolding, crush injuries, possible internal bleeding, at least 2 with compromised airways. The first ambulance arrived. Maria watched from the hallway as paramedics wheeled in an unconscious man, construction vest torn and bloody. Second ambulance brought a worker with obvious leg fractures, third, fourth, fifth. Each case more critical than the last, the ER transformed into controlled chaos. Dr. Walsh was shouting assignments, residents running between trauma bays, nurses trying to establish IVs on patients whose veins had collapsed from blood loss. Maria positioned her cart against the wall and watched. She'd seen scenes like this before, in places where helicopters brought wounded soldiers instead of ambulances bringing injured workers. "Dr. Park," Dr. Walsh called out, "take Trauma Bay 3, construction worker, possible internal bleeding." Kevin rushed to the patient, a young man, maybe 25, conscious but pale. Maria could see from 30 feet away that the patient was in shock. hypotensive, tachycardic, classic signs of hemorrhage. Dr. Park began his examination, but Maria could tell he was overwhelmed. Too many patients, too little experience. The resident was following textbook protocols, but battlefield medicine had taught Maria to read trauma differently. The patient needed immediate surgical intervention, not lengthy diagnostic workups. "Maria," called Nurse Stevens, "can you clean up Bay 2? "We need it for the next patient." Maria moved toward Trauma Bay 2 with her mop, but her eyes remained on Dr. Park's patient. The young man's blood pressure was dropping. His breathing was becoming labored. From her position cleaning the floor, Maria could see what Dr. Park couldn't. The patient's abdominal distension, the way he guarded his left side, the pallor that spoke of internal bleeding. Splenic rupture, Maria thought automatically, needs surgery within the hour. "Dr. Park," she heard Dr. Walsh call from across the ER. "What's your assessment?" "Possible internal injuries," Kevin responded, ordering CT scan and full panel. Maria stopped mopping. A CT scan would take 30 minutes the patient didn't have. She'd seen this exact injury pattern in Kandahar. Young soldier, similar mechanism of injury, same clinical presentation. That patient had nearly died while they waited for imaging that confirmed what battlefield experience had already diagnosed. Maria looked around the ER. Dr. Walsh was managing 2 critical patients simultaneously. The other residents were overwhelmed with their own cases. Dr. Park was following proper protocol, but protocols written for stable patients, not battlefield conditions. The patient's oxygen saturation dropped another point. Maria made a decision that would change everything. "Dr. Park," Maria said quietly, approaching the trauma bay. Kevin looked up, surprised. Hospital janitors didn't interrupt medical procedures. "Yes?" "The patient needs immediate surgical consultation. His blood pressure is dropping, and he's showing signs of splenic rupture." Dr. Park stared at her. "I'm sorry, who are you two?" "Maria Gonzalez. And 12 years ago, I was Major Maria Gonzalez, trauma surgeon, U.S. Army Medical Corps." The trauma bay fell silent. Even in the chaos of the ER, nearby staff turned to look. "That's impossible," Kevin said. "You're a janitor." Maria looked at the monitor displaying the patient's vital signs. Blood pressure 80/40 and falling, heart rate 140. Classic shock progression. "Dr. Park, this patient has approximately 15 minutes before he goes into irreversible shock. The CT scan you ordered will take 30 minutes. The surgery he needs will take 2 hours. The math doesn't work." Dr. Walsh appeared at Maria's shoulder. "What's going on here?" "The janitor thinks she's a doctor," Kevin said, confusion evident in his voice. Maria didn't look away from the patient. "Dr. Walsh, I've seen this injury pattern dozens of times. Blunt abdominal trauma, mechanism consistent with the construction accident. Clinical presentation is textbook splenic rupture." "Maria," Dr. Walsh said carefully, "you need to step back and let us handle this." The patient's blood pressure dropped to 75/35. Maria turned to face Dr. Walsh directly. For the first time in 12 years, she wasn't the invisible janitor. "Doctor, I graduated magna cum laude from Johns Hopkins Medical School. I completed my surgical residency at Walter Reed. I served 3 combat tours as a trauma surgeon. I've performed over 300 emergency surgeries under conditions that would shut down this ER." The trauma bay had gone completely quiet. "I've been cleaning this hospital for 12 years, but I never stopped being a surgeon." Dr. Walsh stared at Maria. Around them, the ER continued its controlled chaos, but Trauma Bay 3 had become an island of stunned silence. "That's impossible," Dr. Walsh said finally. "Your employment records show Maria Gonzalez, high school graduate, custodial services," Maria interrupted, "because that's who I needed to be when I came here." The patient's oxygen saturation dropped to 89%. "Dr. Walsh," Maria said, her voice taking on the authority of someone accustomed to making life-and-death decisions under pressure, "we can discuss my credentials after we save this patient's life." Kevin looked between Maria and Dr. Walsh, his training telling him to follow chain of command, his instincts telling him something extraordinary was happening. "What do you need?" Dr. Walsh asked quietly. or 2 if it's available. 2 units of O-negative blood stat. And I need Dr. Park to assist. He's about to get the fastest education in trauma surgery he'll ever receive. Dr. Walsh hesitated for exactly 3 seconds, then turned to the nearest nurse. Prepper 2 immediately. Call blood bank for 2 units O-negative. Page anesthesia. Emergency surgery. Maria was already moving, her hands checking the patient's pulse, examining his abdomen with the practiced efficiency of someone who had performed these assessments hundreds of times. Dr. Park, she said, start 2 large-bore IVs, get the blood flowing, and call his family. Tell them he's going into emergency surgery, but we expect full recovery. Kevin stared at her. How can you know that? Maria smiled for the first time in 12 years of night shifts. Because I've saved patients in worse condition with less equipment in the middle of war zones. This is what I do. As they wheeled the patient toward the elevator, Dr. Walsh walked beside Maria. Major Gonzalez, she said quietly. Just Maria, Maria replied. I left the rank behind with everything else. Why? Dr. Walsh asked. Why hide this? You could have been our chief of surgery. Maria looked down at her blue janitor's scrubs. Because sometimes you need to disappear in order to find peace. Or 2 hadn't seen Maria Gonzalez in 12 years, but it welcomed her back like an old friend. The surgical instruments felt natural in her hands, the rhythm of the operating room, the coordination between surgeon and anesthesiologist, the precise ballet of life-saving medicine. It all came flooding back. 10 blade, Maria said, her voice steady and authoritative. Dr. Park, now scrubbed in as her assistant, handed her the scalpel with hands that only trembled slightly. Dr. Park, Maria said as she made the initial incision, what you're about to see is a damage control laparotomy. We're not trying to make everything perfect. We're trying to stop the bleeding and save the life. The surgery proceeded with textbook precision. Maria's hands moved with muscle memory developed over years of operating under the most stressful conditions imaginable. There, she said, pointing to the spleen. Grade 4 rupture, just as I suspected. Dr. Park, can you see the bleeding? Kevin nodded, amazed at how quickly Maria had identified and accessed the injury. In a civilian hospital, we have the luxury of careful dissection, Maria continued, her hands working steadily. In a field hospital, you learn to be fast, efficient, and certain. Same principles apply. 30 minutes later, the bleeding was controlled, the spleen was repaired, and the patient's vital signs had stabilized. Beautiful work, said Dr. Rodriguez, the anesthesiologist, who had worked with Maria years ago but hadn't recognized her until she started operating. Just like riding a bicycle, Maria replied, beginning to close the incision. As they wheeled the patient to recovery, Dr. Park walked beside Maria in stunned silence. How? He finally asked. How what? How do you go from being a trauma surgeon to mopping floors? How do you hide something like this? Maria removed her surgical gloves and looked at her hands, hands that had just saved a life, hands that had been pushing a mop cart 8 hours earlier. Because sometimes the war follows you home, Dr. Park, and sometimes the only way to heal yourself is to serve others quietly. 3 hours later, Maria sat in Dr. Walsh's office, still wearing surgical scrubs but with her janitor's ID badge clipped to the pocket, a symbol of the 2 lives she'd been living. Explain, Dr. Walsh said simply. Maria took a deep breath. I came back from Afghanistan 12 years ago. 3rd tour, 18 months of non-stop trauma surgery. When I got home, I couldn't sleep, couldn't eat, couldn't be around people without seeing casualties. She looked out the window at the pre-dawn darkness. I tried going back to civilian surgery, but every patient reminded me of soldiers I couldn't save. Every emergency reminded me of attacks I couldn't prevent. So you became a janitor? I needed to be around medicine, but not responsible for life and death decisions. I needed to serve, but quietly, invisibly. Dr. Walsh leaned back in her chair. For 12 years. For 12 years, Maria confirmed, and it worked. I found peace in the routine, in the service, in being helpful without being central. Until tonight. Maria nodded. Until tonight, when muscle memory and training kicked in faster than common sense. Dr. Walsh stood up and walked to the window. Maria, what you did tonight, the diagnosis, the surgery, the leadership, it was extraordinary. It was just medicine. No, Dr. Walsh turned around. It was what happens when experience meets excellence. You saved that young man's life, and you taught Dr. Park more in 3 hours than he'd learn in 3 months. Maria was quiet for a long moment. What happens now? That depends, Dr. Walsh said. Do you want to go back to being invisible? Maria thought about the operating room, the precision of surgery, the satisfaction of saving a life with her own hands instead of just cleaning up afterward. I don't know if I can, she admitted. The next evening, Maria arrived for her regular shift at 10 p.m., but instead of going to the custodial supply room, she stopped at Dr. Walsh's office. I've been thinking, Maria said, and I want to make a proposal. Dr. Walsh gestured for her to sit down. I'll continue working nights, Maria said, but not as a janitor, as a trauma surgeon. Night shifts are when you need the most experienced physicians and when the most critical cases come in. Maria, there are licensing issues, credential verifications, hospital board approvals, all of which can be resolved, Maria interrupted. My medical license is current. My board certifications are valid. The Army kept my credentials active in case I ever decided to return to medicine. Dr. Walsh smiled. You've already looked into this. I spent all day making phone calls I should have made 12 years ago. What about your need for invisibility, for quiet service? Maria looked down at her janitor's uniform, then back at Dr. Walsh. I realized something today. I wasn't hiding from medicine. I was hiding from responsibility, from making decisions that matter, from being who I was trained to be. She stood up. I can serve quietly as a surgeon, Dr. Walsh. I don't need recognition or praise. I just need to use my hands for what they were trained to do. 2 weeks later, Dr. Maria Gonzalez began her new position as night shift trauma surgeon at St. Mary's Hospital. She wore scrubs instead of a janitor's uniform, carried a stethoscope instead of a mop, but her approach remained the same. Quiet competence, invisible excellence, service without fanfare. Dr. Park became her most devoted student, learning battlefield medicine techniques that weren't taught in medical school. Dr. Walsh often stopped by the ER during night shifts, amazed at how smoothly trauma cases were managed under Maria's guidance. 6 months later, Maria stood in Trauma Bay 3, teaching a group of residents how to handle multiple casualties. Her quiet authority had transformed the night shift into the hospital's most efficient trauma unit. Remember, she told the young doctors, in trauma surgery, your first impression is usually correct. Trust your training, trust your instincts, and move quickly. Dr. Park, now much more confident, nodded. How do you stay so calm under pressure? Maria smiled, adjusting the patient's IV. Because pressure is what teaches you. Every difficult case makes you better for the next one. Is it true you operated for 72 hours straight in Afghanistan? Asked Dr. Chen, a new resident. Once, Maria said simply. But that was then. This is now. After the teaching session ended, Maria walked through the hospital corridors, the same halls she'd mopped for 12 years. But now she saw them differently, not as a place to hide, but as a place to heal. The construction worker she'd operated on 6 months ago had recovered completely and returned to work. He'd sent a thank you card that Dr. Walsh had framed and hung in the trauma bay. Maria never mentioned that she'd been mopping floors the night she saved his life. Some stories didn't need to be told in their entirety. Chapter 10. The Quiet Hero. Late one night, during a rare quiet moment in the ER, Dr. Park found Maria reviewing patient charts. Maria, he said, can I ask you something? Of course. Do you regret it? The 12 years cleaning floors instead of saving lives. Maria looked up from the charts, considering the question carefully. Kevin, every patient whose room I cleaned, every family member I smiled at in the hallway, every small act of service, those mattered too. I wasn't wasting time. I was learning a different kind of medicine. What do you mean? In the Army, I saved soldiers' bodies. As a janitor, I learned to serve people's dignity. Both are important. She returned to her charts. Besides, those 12 years taught me something I never learned in medical school. What's that? Maria smiled. That healing doesn't always happen in operating rooms. Sometimes it happens when someone empties your trash without being asked, or mops your floor so you can focus on what matters. Dr. Park nodded slowly, understanding something profound about service and purpose. As he walked away, Maria continued working, her hands, the same hands that had held scalpels and mop handles, now saving lives with the quiet competence she'd always possessed. 2 years later, Dr. Maria Gonzalez received the hospital's Excellence in Emergency Medicine Award. At the ceremony, she wore her dress uniform from her Army days, displaying the ribbons and decorations she'd earned serving her country. But in her acceptance speech, she didn't talk about battlefield surgeries or military service. Instead, she spoke about the night shift janitors, the housekeeping staff, the maintenance workers who kept the hospital running while others slept. Excellence in medicine, she said, isn't just about what happens in operating rooms. It's about everyone who serves, everyone who contributes, everyone who shows up to make healing possible. After the ceremony, she changed back into her surgical scrubs and returned to the night shift. Because that's who Maria Gonzalez was, someone who understood that true service often happens without recognition, that real heroes sometimes push mop carts before they pick up scalpels. And sometimes, the most important surgery of your career happens when you're supposed to be invisible. The next time you see a hospital janitor working quietly in the background, remember Maria's story. You never know what hands are holding that mop, what training lies behind that humble service, what heroism hides in plain sight. Because at Hidden Legends, we know that extraordinary people often disguise themselves as ordinary workers, serving quietly until the moment when their hidden talents can save lives. Maria Gonzalez proved that you don't stop being a healer just because you change your uniform. You just find different ways to serve, different ways to care, different ways to make the world a little better. And sometimes, when the moment demands it, you remember exactly who you were trained to be.